All right. Thank you all for joining today. Again, for that great introduction as well. And for some reason, my slides are not sharing right, even though we practice this, but I'll make it work. No problem at all. Okay, so we'll move on to the next slide. So again, my name is Kim Bush. Thank you all for meeting with me today. This CEU was actually developed a few years ago, and by a couple of our other instructors that we had. It has since been updated over the last 2 or 3 months. So we've added quite a bit of curriculum based to this and content. So we'll be going over the basic biology of the heart and arteries, talking about what is high blood pressure, which is hypertension, history, diagnosis and treatment, risk factors, causes and possible symptoms, prevention, and what about low blood pressure? I have to say that slow or I get tongue twisted. And then hypertension in pregnancy. Of course, our objectives, you'll be able to define hypertension, identify risk factors and possible symptoms of hypertension, and then identify low blood pressure and discuss the basics of hypertension in pregnancy. So let me move my screen over to the other side because, okay. So the basics of the biology of the heart. So the heart is an organ composed of a muscle. So just like any other muscle you have, we need to work our muscles. So we don't want to overwork them, of course, but we want to provide for nutrition for them as well. So the heart is located between the lungs and the center of the chest. This is what the heart looks like. Sometimes we're thinking it doesn't look that way, but this is just showing the inside there and the different ventricles, the atrium. So there's 4 chambers, which include those, the left and right atrium and the left and right ventricle. So it does pump deoxygenated and oxygenated blood through the body, working with our arteries and veins. So it's very important that our heart gets the correct amount of oxygen so it can pump correctly. So talking a little bit about the arteries here in our body, which sometimes we don't think about this, but our arteries are muscular and they are like little tubes that go through the vessels, and they can vary in size. They can be large or small, but it does carry that oxygenated blood, and it nourishes our heart and our body. So they are high pressure. So the pressure is involving what's high or low blood pressure. So a pulse can be felt over the skin on one's laying directly right under your skin, so you can feel your arteries, or sometimes you can actually see the outline of them depending on your, your body type. So I would like for, before we get started, I would like for each of you to tell me how you would define hypertension. And then also, what role would a community health worker play in the management of hypertension? So feel free to put those in the chat. I'll give you just a few seconds to do that. And I know that we'll be reading off some of those and kind of discussing it. Maria or Megan, would you like to read any of those once they get in there?
Yeah, so far we have someone who stated high blood pressure, general pop greater than 140 over 90, high blood pressure that causes the heart to overwork, facilitate follow-up, when the heart must work harder than usual to move blood through the body, blood pressure that is higher than 140 over 80, a condition in which the force of the blood against the artery walls is too high. The CHW is supposed to support and educate the patient. Information dissemination. HTN is greater than 140/90. The pressure of the blood going in and out of the heart, and it is high. Someone else responded, a silent killer. Pressure in the arteries again is high. Again, consistent readings of 140/90. Hypertension is when the heart is working too hard to pump blood through the heart. Again, high blood pressure and CHWs can provide education. Someone else mentioned, I feel that CHWs will assist in major role to support folks in education and SMBP.
Yes.
Another for high blood pressure in the arteries. Someone just shared that they have high blood pressure and it is also a problem that runs in their family. A couple more of the same readings, 140/80 and 140/90. Registration of patients for blood pressure events in the community. The role is to assist with medication compliance. CHW will educate patients on blood pressure and to prevent by education. High blood pressure that is uncontrolled. As for the role of CHW, someone else said to provide education and monitoring of blood pressure as well. CHW is there to educate the patients. Someone else said abnormal high pressure of the force of blood going through the arteries. A CHW can work with patient to facilitate with a cardiologist and their PCP, identify any needs they have that prevent their HTN management and connect them to education and coach them to make smart goals. Again, CHW can help connect them to resources to promote better health, provide education, as well as goal setting. Someone else said that it is when you are stressed and blood pressure is increased beyond the normal. Age specific greater than 55 with blood pressure 150/90. Someone else said plain and simple is a pressure exerted on the vessels of the body. Assisting the patient with learning how to use a blood pressure cuff, record readings, medication compliance is another role that CHWs play. Someone mentioned unable to eat high food in salt or food high in salt, I'm sorry.
Yeah.
Provide education on reducing HTN through diet and exercise. Again, medical compliance and risks of non-compliance. Someone else mentioned the importance of CHWs needing to explain this in outreach educational sessions. Education, again, assessing compliance support. Educating that it can be treated with medication, but it can be regulated with exercise and healthy eating. Letting them know that increased pressure will harden veins faster. CHWs are also there to educate on systolic versus diastolic. CHW can help educate on what causes elevated HTN. Again, more about diet and exercise and monitoring.
Those are really great definitions.
So many more.
Yeah. Go ahead. I'm sorry, Megan.
Oh no, the others are pretty much the same. They're all, most individuals responded, you know, CHW's role is to provide education and resources and support and assistance. So yes.
Yeah, that's exactly right. So many of y'all already know a lot about this. We'll go into a little bit more detail about hypertension and some additional things that you may or may not know. But I'm glad that many of y'all already have a pretty working knowledge of hypertension and the role the community health worker plays. And really, the role is mostly the same. However, depending on who you're working with, what population you're working with, you know, and how you work with an older person versus a younger person, or someone that speaks your language or someone that does not. So there's a lot of different ways that, you know, people can work, and community health workers can work with individuals that are having issues with their blood pressure, whether it's hyper or hypotension, so high or low. So thank y'all for sharing. I really appreciate that. And that does help me in learning what knowledge you have. in that. So we'll just go over a few of the facts about hypertension. So according to the American Heart Association, there's about 1 in 3 adults that have hypertension. It's also a primary or contributing cause of death for more than 494,000 deaths in Americans in 2018. That's the latest statistics. These are all from CDC websites, so you can go there and look these up yourself, or you can refer back to it over time because it does change. They update that, frequently. But according to CDC, about 1 in 4 adults with hypertension have their condition under control. That's not very many. So what about the other 3? So how can we help them? As y'all have mentioned, many things that could be done, but how can we help them improve that? Also, hypertension costs the U.S. about $131 billion each year. That's an average over 12 years from 2013 to 2014. $131 billion is quite a bit of money that can be used for other things, such as homelessness or, good foods or a food bank or any type of, activities that could help improve quality of life for everyone. The prevalence of hypertension for men is a little higher at 57.1%, and with women, it's at 39.7%. And the prevalence does increase with age. And it is highest among non-Hispanic Black adults at approximately 49.6%. So depending on, and also your genetics, all of that's going to affect your predisposition to hypertension, and depending on your lifestyle and on your eating patterns as well. So the definition of high blood pressure is the pressure of blood against artery walls as it circulates throughout the body. And I'm going to share this very brief video about how the blood pressure works through your body. Hopefully it's going to work correctly.
When your heart beats, it pumps blood around your body.
We could hear it, but we can't see the video.
Okay, let me fix it right quick. Okay. Not sure why that went to the other screen.
When you're
Okay, you should be able to see the screen now.
Yes.
Okay.
Your heart beats, it pumps blood around your body. As the blood moves, it pushes against the sides of the blood vessels. The strength of this pushing is your blood pressure. As your heart pumps, the flow of blood in your arteries and your blood pressure rises and falls in a regular wave pattern. Blood pressure is shown as 2 numbers. The top number, or systolic pressure, is the pressure when your heart beats. The bottom number, or diastolic pressure, is the pressure when your heart relaxes. Healthy blood vessels can stretch to allow for these changes in pressure. Damaged blood vessels are less stretchy, which increases blood pressure. Constant high blood pressure puts extra strain on your heart and blood vessels. Over time, this increases your risk of a heart attack or stroke. It can also cause problems for your eyes and kidneys. High blood pressure speeds up the process of atherosclerosis, where fatty streaks form inside the arteries. If one of these cracks, it can cause a blood clot in your arteries. This is what causes a heart attack or stroke. It's never too late to make changes to protect your heart. Think about your future, being there for your family, your plans and dreams. Could your blood pressure affect this? There are small steps you can take today to lower your risk. If you smoke, stop smoking. Make heart-healthy eating and drinking choices. Move more, lose weight. Talk to your doctor about medications.
Okay, let me stop sharing the screen and share my other screen. Okay. So everybody can see my PowerPoint presentation?
Yes.
Again? Okay, great. All right. So that video did describe it a little more in clinical terms, but also did give illustration to help show how that works.
All right, engineers, so what we're going to do in this video is we're going to talk about the basics of EKG. This is a really important diagnostic tool that we should use as clinicians. It's important for being able to look for arrhythmias, being able to look for possible myocardial infarctions. So it's a great tool that we as clinicians should be able to understand. In order for us to do that, we have to really kind of dig in.
Okay. Cancel that. I'm so sorry. It is much easier to do the slides when you are not doing this virtually. So the wrong, okay. All right, so now we're going to go to the history. I apologize for some of my technology challenges there. So let's talk about some history of blood pressure. So in 1733, Reverend Stephen Hales was the first person, to measure the direct intra-aortic pressure in a horse. So that's kind of the first blood pressure example. Back in the late 1800s, I'm probably not going to say this word correctly, but the sphygmograph, was the first non-invasive blood pressure measuring device invented. So as you can see, this is a pretty daunting instrument here. I don't know if many of us could utilize this at home like we're so used to doing, putting on a small cuff. Any thoughts on this blood pressure measuring device, the sphygmograph? I'm thinking.
Someone said it's scary looking and it looks interesting.
Yes, definitely. And I'm thinking you probably need to be someone that is trained in all that to monitor the blood pressure or to actually get a blood pressure reading. I'm sure that wouldn't be like doing self-management of blood pressure. So thank goodness we have progressed since then. So 1940, treatment of the blood pressure, elevated, and it was not deemed appropriate unless malignant or accelerated hypertension present. There wasn't a big emphasis on treating blood pressure during that time. There were only 10 references to hypertension or its therapies that were included in, the gold standard as a pharmacy textbook. So people were not really thinking about blood pressure and what do we need to do to, prevent hypertension or prevent stroke or heart attacks that high blood pressure can cause. Okay. So moving on to the 1960s to 1990s, so we're getting closer to current years, still quite a bit off, but the first Veterans Administration study in severe hypertension was published in 1967, and it demonstrated that antihypertensive drug treatment reduced the incidence of stroke, congestive heart failure, and kidney damage in patients with systolic blood pressure greater than 105. So the systolic is the top number and the diastolic is the bottom number. So if it was above 105, now they're saying it's 90. We want it to be below 90. So now we have moved on to the 21st century, and prevention is the primary approach. It is key. That's why we have these educational sessions, awareness, just even though you may know, like many of y'all already know quite a bit of this information, it's just a reminder, or maybe there's a tidbit of information that you might gain that could be helpful to someone you're working with, yourself, your family. But there exists well-tolerated pharmacological therapies, medications that can be used to prevent and treat hypertension. It's not always just medication, so sometimes there needs to be more lifestyle changes to actually prevent or treat, manage the hypertension so it doesn't get out of control. There is a lack of fundraising venues and hypertension research. One of the projects I work on does work with not necessarily hypertension research, but we work with self-management of blood pressure, and we do track their blood pressure readings over time. So that is, helpful in research since there's not a lot of funding out there. So where are we going? What is our future? The American Heart Association is launching a new evidence-based, community-driven effort to reduce hypertension. Their goal is to increase blood pressure control by working with community members, different businesses and organizations and community health centers across the country. They want to help remove barriers and improve health for vulnerable populations. So there are a lot of community events and community settings that American Heart Association is working with. They also offer an annual blood pressure summit called Target BP. You can actually go to their website and look up that program, Target BP. So they want to provide a lot of community education. They want to encourage the best practices in clinical settings. And they do that in their Target BP program, which talks about measuring blood pressure accurately and making sure that, when you are taking a blood pressure, there are certain steps that one should follow. They really shouldn't be talking. They should be sitting up straight, their feet on the floor. They need to have a cuff on that's the correct size and different things like that. If anyone's interested in that, I would definitely recommend you going to the Target BP website and at the American Heart Association Target BP, and I'll tell you more about that. So now let's talk about some symptoms and causes of high blood pressure. So remember that hypertension, and someone mentioned it in the chat, that hypertension is called the silent killer because it usually has no warning signs or symptoms, and many people do not know that they even have high blood pressure. A lot of times people will not realize that they have a headache or symptoms, and they're actually having high blood pressure, which if they do not get it treated could lead to a stroke or heart attack. So how would you know? If you start having some symptoms, you're needing to get to the doctor quickly. But prior to that, you want to make sure that you're getting your blood pressure checked regularly with your primary care doctor or a health professional that can measure your blood pressure accurately. And also, you do want to make sure that when it comes to your diagnosis, that they're actually getting a correct diagnosis, because sometimes if you go in to get your blood pressure, maybe you just ran from the parking lot and then your blood pressure is showing 185 over 95, and then the next time you come in, you're upset about something, so you also have another elevated blood pressure. So you need to make sure that they're measuring your blood pressure at appropriate time. You want to make sure you are rested, because if you just run in from the parking lot at the doctor's office or a clinic and they take your blood pressure immediately, it is going to be higher. You should wait at least 5 minutes. And I know that, and I'm not trying to say anything about any of the nurses, but they do like to ask you a million questions when they're taking your blood pressure. But you should not, to get an accurate blood pressure, according to the Heart Association, it's important not to be talking when your blood pressure is being taken. And you can learn how to use a monitor at home properly. So you can measure that at home, and you can bring in some readings to your physician when you go in and see them, and to show them the difference when you're more at ease. Because sometimes just going to the doctor could make your blood pressure rise. So it is quick and painless, but it does need to be measured accurately. So I have a home monitoring video that we're going to show. And let me make sure that I'm sharing appropriately.
To monitor your blood pressure using an automatic blood pressure monitor, find a comfortable place to sit with good back support at a table or desk. When you're ready to take your blood pressure, sit quietly for 3 to 5 minutes beforehand. Place your feet flat on the floor and rest your arm on a tabletop, even with your heart. Lean against the back of the chair. Stretch out your arm, palm upward. Place the cuff on your bare upper arm 1 inch above the bend of your elbow. Make sure the tubing falls over the front center of your arm so the sensor is correctly placed. Pull the end of the cuff so that it's evenly tight around your arm. You should place it tight enough so that you can only slip 2 fingertips under the top edge of the cuff. Make sure your skin doesn't pinch when the cuff inflates. To get started, wait a moment, then press start. Remain still and quiet as the machine begins measuring. The cuff will inflate, then slowly deflate so that the machine can take your measurement. When the reading is complete, the monitor displays your blood pressure and pulse on the digital panel. If the monitor doesn't record a reading, reposition the cuff and try again. Rest quietly and wait about 1 to 2 minutes before taking another measurement. Record your numbers either by writing the information down or by entering the information into an electronic personal health record. Some monitors can upload your blood pressure readings automatically.
Okay. So that was just a video about how you could use a self-monitoring at home. Let me get out of this.
To monitor your blood pressure using an automatic blood pressure.
Close one other window. All right. Does anyone have a blood pressure monitor at home that they use regularly? Megan or Maria, I can't see the chat.
We have a couple of yeses coming in.
Okay, great.
About 4 yeses.
Okay. Yeah, and it's sometimes hard to get in the habit of doing that, but you know, you do want to check it. If you do have high pressure, you want to check it pretty much every day, and you do want to check it in the morning and at night. If you do not have high blood pressure, but you just want to keep check on it because maybe you have some of that genetic predisposition, so you might want to check it once a week. Or, but you know, write it down. If you see that it's going up or going down, you want to pay attention to what you were doing. So if it's up really high, okay, what did you eat or what did you do? And if it's low, then you know the same thing, because that helps you determine. You know, keeping that diary is going to help you determine what you need to do or keep doing or stop doing. So you definitely want to use a correct cuff size. Put it on your bare arm. So if someone has on a long sleeves, they would need to roll it up or remove, if it's a sweater or a coat, to remove that. You know, have that support at the heart level. Keep the legs uncrossed. Support your feet and back, and empty your bladder first, and then refrain from having conversation. And as I mentioned, when you're going into the doctor's office, they like to ask you a lot of questions. So just say, can you give me a minute? Let me get my blood pressure. I have done that before. Sometimes they get upset because they're the nurse. But I'm just, hang on just a second, you know, try to make it to be more nice. So what are some contributing factors to, you know, high blood pressure? So there are positive factors and negative factors, and kind of something you cannot change. So the negative and positive you can change. You know, eating lots of fresh fruit and vegetables, fish, physical activity, even if it's and walking around your house or sitting in a chair doing leg lift or some type of physical activity, taking vitamins and oxidants. And I can't really promote all, but they do say that red wine is positive. And of course, that's going to be in limitation, not drinking a bottle each night. But some negative factors. So eating a hamburger, ice cream, sundae, smoking, and too much alcohol. So really limiting your fatty foods or high cholesterol or high in salt, sodium foods, and then smoking. If you do smoke, at the very least, try to limit that smoking, and then eventually, hopefully, stop the smoking. It will add many years to your life in general. And then things we can't change, you know, our genetics or our heredity. If we're predisposed, you know, if our parents have high blood pressure and their parents had high blood pressure, we can't change any of that. So we can only change those negative and positive factors. We can't change our gender or our ethnicity in regards to contributing factors for hypertension. And then, of course, the older we get, it may be harder as well, because we all are going to age, whether we really want to or not. So let's talk about sodium. So more than 70% of the sodium, which is salt also, we eat comes from packaged, processed, store-bought, and restaurant foods. So it is so nice sometimes to just go out to eat or pick up something and take it home after work. It is so much simpler than cooking and then having to clean. But we have to understand that more of this does have, higher salt, higher sodium than other times. The other foods that you make at home, even if it's a canned soup, sometimes there's a lot of sodium in canned soup. But the U.S. guidelines do call for less than 2,300 milligrams of sodium per day, which is about 1 teaspoon of table salt, which 2,300 milligrams sounds like a lot, but when you measure it down to 1 teaspoon of, say, table salt, that's not that much salt. I know that on the movies, the movie theater, the popcorn from the movie theater has a lot of salt, but it is good. But they do have a lot of salt on there. And maybe you went to the movies and ate a lot of popcorn, and the next morning you wake up and you are feeling a little, I guess the word will be bloated, or you're feeling, maybe feeling bad. And so you check your blood pressure. Your blood pressure may be up because you had so much salt, whether you have high blood pressure or not. Also looking at the food labels. So the top 6 sodium sources in our diet is bread and rolls, pizza, sandwiches, cold cuts, and cured meat, soup, burritos, tacos. Man, I wanted some tacos, and I'm wondering if tacos are eating the tacos out somewhere. If you made some tacos and to, decrease the salt and the sodium, maybe it's the shell. But we have to find out where is the sodium coming from and try to decrease that. And again, they're probably talking about fast foods, such as like Taco Bell. There probably is a lot of sodium there. But on the food label, so this is an example of a food label. You can see the sodium at 130 milligrams, and it'll tell you the percentage of the daily value. So this was from a cereal box, this food label. So it's telling you the cereal, and then if you add a half a cup of skim milk, and how much is the the serving of cereal, so 1 cup. Many people eat more than 1 cup of cereal when they're eating cereal. I know I usually do, which is bad. And then usually I don't drink skim milk, but I do drink 1%. But so trying to reduce that down to skim milk. But your sodium, so if you have just 1 cup of cereal, it's 5% of your daily value of sodium. And if you have, add the milk to it, which normally are, then it goes up to 8%. So some other examples, a cup of canned soup has as much as 744 milligrams of salt. That's quite a bit more than the 130. And then 1 tablespoon of teriyaki sauce has as much as 690 milligrams of salt. That's just 1 tablespoon. And then 8 ounces of vegetable juice has as much as 420 milligrams of salt. Even though vegetable juice could be for you, you have to always look at the salt. So people with not only high blood pressure, but maybe they have congestive heart failure, that's one thing that has to always be watched, is the level of sodium, because that could create too much water that their heart cannot pump off. And that's what congestive heart failure, relate to. A person can drown in their own fluids because they've been eating all this salt. Their heart can't pump it off. And the medication they're taking may or may not be working, but medication sometimes only works over a period of time. And it's always best to add with, with lifestyle change. So your diet and exercise. Then 1 tablespoon of soy sauce has as much as 1,024 milligrams of salt. That's quite a bit. So we have to remember and to look at what we're eating, and looking at those food labels, and not picking those with higher rates of sodium. So some different names for sodium. Sodium alginate, sodium ascorbate, sodium bicarbonate, which is baking soda, and a lot of things require baking soda to cook with. So for example, cakes, cookies, if you're baking a cake that's not a boxed cake, they're gonna more than likely ask you to add some baking soda or a little bit of salt. So I'll give you an example. I made this from scratch cake for Thanksgiving, and it was chocolate cake with homemade Hershey icing. And so when the cake was baking, I noticed it wasn't really rising. It was supposed to fluff out. It wasn't doing that. And I thought, well, what happened? So when I took it out and it was done, it did not, it didn't fluff or anything like that. So I went back to ingredients I was looking, and somehow I forgot to put the baking soda in there. And it was only like a teaspoon of baking soda, but that made a huge difference. So that really gives me an example of what baking soda, which is sodium, will do to your body. It'll bloat it up, or, make it be more, retaining fluids and retaining other salt. It just, makes it, it's great, but for our bodies, it's not. So I just thought that was interesting that just happened to me. But the cake tasted okay, but it was hard, almost hard as a rock, because it didn't have the baking soda. The other names here, sodium benzoate, sodium caseinate, sodium chloride, sodium citrate, hydroxysaccharin, sodium sulfite, glutamate, trisodium phosphate, and there's several others out there. These are the main ones. And then, of course, sodium, the element is Na. So if anyone remembers their elements from the table when they were in school, comes from that. So lack of exercise is huge in maintaining or managing your blood pressure. So you want to stay physically active. It can help reduce the blood pressure. It'll help control your weight, reduces stress. So a lot of times when individuals are stressed out, you know, take a walk. You don't have to go to the gym and, you know, work out or run 5 miles, or you can just do what you can do, any type of physical activity. So when you are more sedentary, or you're some call a couch potato, you know, you don't have a number of physical activity that you should have, it's going to increase your risk for a heart attack, a stroke, and also contributes to obesity. And it may not while you're young. Sometimes people can eat whatever when they're young, but as they get older, they're less likely to maintain, you know, a small figure or to keep the weight off. So the Mayo Clinic says that inactive people have higher heart rates, meaning more stress is placed on your artery walls. So that's why when you have stress on something, it usually tends to react. And if your body, you know, your blood pressure is higher, you stress, then you are going to be more likely to have some type of reaction as a stroke or heart attack. And then of course, obesity, that's one risk factor that leads to many different chronic illnesses, but it definitely can play on your heart because it's having to work harder and carry that around. For example, you could take a sack of 5-pound or 10-pound sack of potatoes, and if you carry that around every day, you know, put it in a backpack and carry it around, just think that's going to be hard on you, and you know, it may cause you problems with walking or holding other things. And so that's an example of how, you know, when you're having extra weight on you, that's working your heart a lot harder. And sometimes the blood flow is not good. And for your heart to be working properly, you need that blood to be flowing properly. So thinking about alcohol, of course, it said that one of the positive factors, you could drink, you know, red wine, but drinking too much can also raise your blood pressure to unhealthy levels. So what is too much? Well, it's different depending on your age and depending on if you're a female or a male. So 2 drinks a day for men younger than age 65. Now, that doesn't mean you would say, well, I didn't drink anything Monday, Tuesday, Wednesday, Thursday. So that's 8 drinks. I can have 8 plus my 2 for Friday, all on Friday. You don't know. They're saying you can have 2 a day, up to 2 a day. Or if you're older than 65 and you're a male, then you should have 1 drink, no more than 1 drink a day. And then for women, it's 1 drink a day, no matter the age that you are. More than 3 drinks in any one sitting can temporarily raise your blood pressure. But if you continue that, you know, binge drinking, it can lead to a long-term increase. So it could lead to high blood pressure by damaging your blood vessels and arteries in your heart. So you definitely want to maintain moderation in your alcohol intake. Women's drinking patterns are different from men's, especially when it comes to how much and how often you drink. Research has shown that women face higher risk than men because, you know, women start having alcohol-related problems with less alcohol in their body. Women usually weigh less than men, and women do have less water and more fat in their bodies than men do. And alcohol dissolves in body water and rations in fat tissues. So what happens is when, as a woman, you know, even though you be thin or may not be overweight or obese, our bodies still have more fat than a male. So therefore, the alcohol is going to saturate in those fat tissues versus a male where their body has more water and it will dissolve quickly, much more quickly than with a male. And then, of course, we've already mentioned this once, as we get older, our blood pressure does tend to rise. According to the National Health Institute, about 65% of Americans that are 60 and older have hypertension. And even though hypertension, can affect anyone, it is more common in African American and Hispanic American adults when compared to the Caucasian adults. Don't know why that is exactly, but different ethnicities and do have different things that they are more prone to than others. So this is a study that's been made, and these are the findings from that study. Now, things may change in the future with, like, just for example, any condition or chronic illness. So, but regardless, we want to make sure that, we are managing our blood pressure, and we want to make sure that we're doing it early so we can catch anything that could be out of control. So systolic pressure, which is the higher number, indicates how much pressure your blood is exerting against your artery when your heart beats. The systolic pressure, which is the lower number, indicates how much pressure your blood is exerting against your artery wall while the heart is resting between beats. So, it's a little bit different, each one. So it's important to know what is normal blood pressure for you, but and I've heard people say less than 140/90. I've heard people say less than 140/80, but according to the American Heart Association, these are the stages of hypertension. So I think many of y'all had said either less than 140/90 or less than 140/80. But this will tell you right here, normal is less than 120 over less than 180. And elevated is anywhere from 120 to 129 over less than 80. And then high blood pressure, which is stage 1, consider hypertension, 130 to 139 over 80 to 89. And then high blood pressure, hypertension stage 2 is 140 or higher, or 90 over 90 or higher. And then a crisis, which you should immediately contact, either go to the ER or call your doctor, depending on, is higher than 180 over higher than 120. So even though that these are established by the American Heart Association, some clinics still, in some of the CDC standards, they still set their goal to be below 140/90. So just depending on what is normal for you, and your provider should, be on that. I know some of the providers that work with our elderly population, our geriatric population, that means older than 65, and even 60 and older, they'll say, I don't want their blood pressure too low. So they want it a little bit higher than 140, but not too much higher. But so it's all up to the provider and that person's health status, what would be considered normal for them. But this is the textbook case for the stages of hypertension. So now we're going to move on and talk. But before we do that, are there any questions out there or any comments anybody would like to say?
There's a couple of comments just
Sure.
saying that this information is very helpful, especially for individuals in health centers that work a lot with individuals who have high blood pressure. This is all good information to have. And we will be sharing these slides with everyone after the presentation and the recording, just because some people are asking if, some of the charts that you included and things like that, if they can have that to share with patients.
Sure, definitely. Yeah. And if you, as I'll mention at the end, my contact information is there, but you can always contact me, email, phone. But yeah, the slides are available to share. And then we can tell you, and at the end of it has all of our resources and references. So you'll be able locate those and actually change. So you definitely want to keep up to date on if anything changes over time. I appreciate all the comments and questions. So let's talk about symptoms and causes of hypotension, which is also known as low blood pressure, which sometimes people think, oh, well, that's nothing, that shouldn't be anything to be concerned about. But yes, we do need to make sure that we do have a good blood pressure, because if it is low, then that could mean there's another issue that may need to be addressed. For example, if someone is recently out of surgery, they have to get a good stable blood pressure before the nurses and all leave to let them rest and start their recovery. But if they can't get a good blood pressure, then that's an emergency, and they could be bleeding internally, or any other type of situation could be happening. So hypotension is less than 90/60. And sometimes people will range this on a reading, but if this is consistently lower than that, definitely need to talk with their primary care provider. Some of the symptoms for hypotension could be some of the same as hypertension, but as long as you're not experiencing symptoms of hypotension, there's not a big need for concern. You just want to keep a watch on it. Most doctors consider chronic low blood pressure dangerous only if it causes noticeable signs and symptoms, such as some of these that are listed here: dizziness, lightheadedness, fainting, dehydration, unusual thirst, lack of concentration, nausea, whether hands are cold or clammy, pale. They have shallow breathing, fatigue, and depression. So now we may have some of these symptoms that are just because of something else, or maybe you have the flu. You may have some of these symptoms. You are have a lot of stress going on in your life. Some of this, may happen. But if you're checking your blood pressure, keeping up with it, and you're having some of these symptoms or all of these symptoms, you definitely want to get checked out. It's always best to, check on things rather than just to let it go, because you want to prevent any further damage to the body, or, and you also want to always work towards improving the quality of life that one has. So some of the things that can cause low blood pressure, prolonged bed rest. So maybe you've had, an illness, maybe you've had a strep throat and you've had to be in the bed for quite a while, but that probably wouldn't be long enough. Maybe you broke a bone and you had to lay in the bed for a lot of times. Maybe you couldn't walk, or maybe you're pregnant and you're on bed rest. So, but there's other complications in that regard. But heart problems, some medications will cause blood pressure to be lower. Endocrine problems. So the endocrine system does do a lot of different things in the body. Your thyroid and other things in regards to your endocrine. Could be your hormonal levels as well, severe infections, allergic reactions, any nutritional deficiencies, and you just may be losing blood or not have enough blood volume. So that could all be some causes of low blood pressure. So understanding the diagnosis, you want to make sure that you understand that well, and to know if you have hypertension or hypotension. A healthcare provider will need to measure your blood pressure and diagnose you. That doesn't mean they're going to measure your blood pressure one time and say, oh, you have hypotension, or no, you have hypertension. It needs to be over several times, not just one reading. And you can also learn how to properly measure your blood pressure at home, which it showed you how to do that on the video we watched a little bit earlier. And making sure you're following those steps. You can also go to the American Heart Association, Target BP, and it has a section for measuring blood pressure accurately. So I would definitely recommend those. So let's talk about some treatment and medication for hypertension or even hypotension, but we'll mainly talk about hypertension. So of course, we talked about lifestyle change. There can be supplements, also medication. It could be one of these or a combination of these, but diuretics, but that's also, a diuretic is, also people call them a water pill, but they are going to make you go to the restroom more frequently. So many people with congestive heart failures, they will take diuretics to get the blood that's surrounding their heart. The water surrounding their heart, the fluid surrounding their hearts off, because you don't want that to for them to start building up that fluid around their heart that would eventually cause death. Then beta blockers, ACE inhibitors, and vasodilators. So any of those could be, and there are different medications that fall under these, but these are the types of medications that a physician would prescribe. Now, it could be included a different medication, and they're always coming out with new medicines, but these are just the main ones that are very common. There's also some supplements that may help lower your blood pressure. Such as fiber and wheat bran, minerals such as calcium, potassium, supplements that increase nitric oxide and widen your blood vessels such as cocoa, coenzyme Q10, or garlic. Now, I'm not saying go out and start taking these if you have high blood pressure, but these are some things that you can do to help. You definitely want to always follow your physician's treatment and guidelines. Omega-3 fatty acids found in fatty fish oil supplements, flaxseed, and probiotics. That are found in fermented dairy products such as cultured sour cream and cheese. There's also sometimes yogurt, Greek yogurt, I know is really good for that. Also, the treatment for high blood pressure during a pregnancy could be similar or it could be different from regular high blood pressure treatment. It all depends on the individual and, where they are in their pregnancy, and, the physician will be the one to determine that. So I have another video here that's going to talk to you about the importance of managing hypertension. So give me just a second to stop sharing and then this one for some reason doesn't want to do right. Let me see if I can do this differently. Maybe there we go. Okay.
My name is Kendra, and I have high blood pressure, and I was diagnosed in 2006. Prior to my diagnosis, I was a single mom. I never exercised. I had headaches all day, every day, especially in the morning or when I went to bed at night. I always felt fatigued. We were sponsoring an event, the company that I worked for, and we went to the event. It was a heart healthy fair. I had my blood pressure checked, and the person who I had the blood pressure check with, she asked me, was I feeling okay? My blood pressure was maybe, the normal was like 120 over 80. Mine was like 150 over, 96. It was really, 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 really high. So after the health fair, I made an appointment to see the doctor. She asked me if anybody in my family had high blood pressure, and I was telling her that my dad had high blood pressure, also diabetes. So then she set me up for a stress test. You had to run like 1.5 miles, and I don't think I only got to, a mile, and I almost fell out. I failed the stress test. My doctor told me that you need to lose some weight, and you definitely have high blood pressure. So I asked her what I could do, and she said, you need to change the way you eat. Just change your lifestyle and the way you eat. I was in denial. I was really, really in denial. I mean, I just decided to make changes, not so much for myself, but for my daughter. I wanted to be around. I lived a very active life, and Kayla is very much a part of my life. And we do everything together, and I didn't want it to be a situation where something would happen to me, something that I could control would happen to me to where I would leave her by herself. So I just decided to make the change. I lost 57 pounds, and I've kept it off. And I lost the weight by changing my diet my food intake and my drink intake of soda. And then I also incorporated water, and then I exercised. I did kickboxing. I started doing Pilates. The people in my life are very supportive. My girlfriend and I, Nikki, and my daughter, we live here, and we all live healthy lives. It's a team effort. Kayla was great. She was always energetic and helping me do things. Nikki was great as well. She made sure that I stayed on task. She is the chief preparer of food in the household, so she makes sure that we always are eating the stuff that we're supposed to have. Start eating more healthier things. We incorporated a lot of chicken, a lot of grilled and baked chicken, a lot of fresh vegetables, and we exercise together. It's just, again, a team effort. Living with high blood pressure is definitely different. It's a lifestyle change that you have to adapt to. Anyone who's diagnosed, there is a turnaround. You just have to make the change and know and be consistent and stick with the change. I just want to be able to live a happy, active life. I want to continue to keep the weight off. I want to make sure that I'm just heart healthy. I mean, it's huge for me. And I just want to be around. She definitely is the person that I say, okay, well, I got to be around. Because I feel, and any parent would feel, that she's destined to do great things, and I want to be around to see those great things that she does.
Okay, this was provided to us by the National Institutes of Health. Gave us some good tips there and reasons why we want to manage hypertension, high blood pressure. I thought that was really neat that she really got active. She went into kickboxing. I don't know if I would do kickboxing, but I'd probably get kicked myself by accident. But finding things that you like to do is important. So, and things you like to eat. Hypertension and pregnancy. We'll talk a little bit about that. But having high blood pressure while you're pregnant or during your pregnancy can be both dangerous for the mom and the baby, not just the mom or not just the baby. So it does affect low birth weight. It could cause a premature delivery. And then, of course, you can damage your kidneys as the mom. You can have a stroke. You could have placental abruption, eclampsia, or preeclampsia. And I know several people who've had preeclampsia during their pregnancy, and but I haven't known anyone else to have any of the other things. Has anyone that's in the training today, have y'all experienced anyone, a friend, family, or someone, or maybe even a patient or someone you know with some of these things that happen to them, high blood pressure during their pregnancy?
There's, yes, a couple of yeses. Someone, they themselves, that happened to them. A friend had kidney damage.
Okay. Yeah, and that's, that is really sad because, you don't want anything to go wrong with your pregnancy if possible. And so knowing, checking your blood pressure and eating things that, the same thing with diabetes, you could get gestational diabetes pregnant, but you definitely want to watch that and make sure that you are in, with a good blood pressure, especially if you're predisposed to that. So what is preeclampsia? That's one of the things that's been noted a lot in pregnancy. So preeclampsia is related to increase in high blood pressure and protein in the mother's urine. This condition usually develops after the 20th week of pregnancy, and it occurs in about 3 to 7% of all pregnancies. So it doesn't occur a lot, but this is something that you do hear about mostly when you have pregnant moms and high blood pressure. So we're just going to show, we're going to show another little video here, just kind of recapping what you need to know about high blood pressure. So I will get that going. Okay, by the end of this presentation, I will have this switching slides down.
It's not a
There is no sound, it is silent. It's basically covering everything we kind of talked about, but just, you know, what can you do? What is it? But there's no sound, I'm sorry. And you can find that at CDC. But one of the things that it did say, you know, you in your in preventing high blood pressure, you want.
Good afternoon,
everyone. Oh, hang on just a minute, I'm sorry.
And welcome to today's webinar.
Okay, sorry about that. You definitely want to make sure that you are, you know, reviewing your blood pressure, making sure, you know, checking it often. If you do see an elevation in your blood pressure, then talk with your primary care, you know, do those things, increase your physical activity. I believe that CDC suggests about 150 minutes, approximately 150 minutes of physical activity per week. So that's not a whole lot, but sometimes, you know, we have to find where can we fit that in, maybe 20 minutes here, 30 minutes there. But we definitely want to try to do that. We need to, you know, reduce the amount of sodium, salt we have in our food. And then, you know, just eating more healthy protein and vegetables, things that are good for us. So you can actually go to this if you want to look at it again, but it's in general, most of all of the things we've talked about to help managing your pressure. So are there any other questions or comments at this time?
And there was a question in the chat. I know that you talked about high blood pressure in pregnancy, but someone asked, what about low blood pressure in pregnancy?
Wow. Okay. So that's a great question. It's usually not presented in presentations about that, but anytime you do have the low blood pressure, it, you know, and it's on a continual thing, it could be another issue, another medical concern. So if you do have that, I would definitely have, you know, if it's you or your family or someone you know, they need to be in touch with their primary care provider and also their OB doctor, so that, you know, there could be issues with the baby. And you definitely want to get that checked out as quickly as possible. There could be some internal bleeding that no one knows about. You know, there's just a lot of things that, so if that's a consistent, you know, below 90 and over 60, then that needs to be addressed with, you know, primary care and the OB doctor, because, you know, they're going to have more experience in that. So that would be more of a specialty situation. Usually it's more the opposite direction, but it could happen. It could. Usually low blood pressure is more of, you know, due to aging or a condition that another medical condition that they have. So you definitely want to discuss that with your doctor in to see how that could be maybe raised up some, or does it need to be raised? Maybe it's just watching it for a while, and maybe it'll raise up on its own. Maybe there's another condition that can be treated. Any other questions or comments?
Yes, Kim. So we have a couple questions about the actual cuffs. So it's recommended to take, no, sorry. We have, if whether they have a wrist cuff, so which is a better measuring system, the wrist cuff or the arm cuff?
Yes. They say, well, the literature says, and physicians will say, you know, the arm cuff is better, but sometimes I know that some other doctors' offices, such as when I went to get my eyes examined, and I go to the dentist just even to get my teeth cleaned, they're putting the wrist cuff on me, and then they're making me put it close to my heart. I don't know how great that is, but it does. I mean, because I know I have an idea of what my blood pressure is most all the time. If I notice it's higher or lower, you know, when I go to get it checked, or maybe I'll just check it at home to see if I'm not feeling good, just to see how, you know, what's maybe going on. Is that something I ate or, but you definitely want to use, if you can, you definitely want to use the arm cuff versus the wrist. Some studies say, or some experts say, that the wrist cuff is not as accurate. So if you're going to purchase one, I would purchase the arm cuff. If it's been given to you, then, you know, it's a little bit different story. You know, when you go to the grocery store or to the sometimes pharmacies, I know Walmart and a local grocery store here, they have blood pressure cuffs. They may have them closed due to COVID, but if they have them open, you can just, you know, use a wipe and see if that, you know, a disinfectant wipe, see if you can clean it and use it, because that would be an inexpensive way of checking your blood pressure off and on. Because so I don't have the money to buy a blood pressure cuff. There are programs out there that can help with that. Also, if they have Medicaid and some insurances, but I know Medicaid, if the physician will write a prescription for that, they can use their Medicaid to get a blood pressure cuff. And a good one is going to be anywhere from $50 to, well, maybe $40 to $100. But usually about that $50 mark is are pretty good monitors. One of our programs here, we have a program where if they do join that program and they complete it, they can borrow the monitor, but if they complete the program over, basically it's 14 weeks, they get to keep the monitor. And we have reused some of them, but most of them are new. So that's a program that, you know, programs similar to that could be helpful in getting the monitor, but the arm cuff is the best one versus the wrist cuff from the that I've been provided. Or you can study it, you know, you can check online through CDC, Mayo Clinic, different places like that.
Kim, and just to follow up your conversation right now, so how about the smartphones? There's chat about what will do to your high pressure and oxygen and heart rate.
Okay, and what would you just say would affect it? I'm sorry.
Are these reliable smartphones that?
Smartphones, yeah. You know, I'm not sure, to be honest. I do know that there are some smartphones, and then some of the watches that you wear can check that. And I'm really not sure how accurate they are, but what you could do is, you know, when you go to the doctor or you go somewhere that they check your blood pressure, and you could check it with your phone, or, you know, kind of compare. I do know also in clinics, they have their machines calibrated. I know they do here, where here at UT Health, East Texas. But most clinics, you know, they do have their equipment calibrated. So that means that they actually are, you know, are checked out. They're, you know, they're in good shape. They're reading correctly. So that might be something you might talk to your, you know, doctor. Have you all calibrated these things? But now if somebody's using a, where they, you know, put the cuff on and then they're checking it, you know, putting the stethoscope, and that's a little bit different because that's a manual reading. So sometimes depending on the person, that reading might be off a little bit. So if it is higher or lower than expected, then you might have them check that. And of course, you're going to tell them in a way, it's like, oh, my blood pressure is usually not that high. Do you mind checking it again in a few minutes? But I mean, I know y'all know how to conversate with people, but I just come across some clinicians will get upset if you're questioning their judgment. So, and being that I'm not a clinician, I wouldn't want to, but we've just been doing this and studying this for, and being trained for the last 5 years. It does stick with us. And, you know, so, you know, that's how people learn. And that's, I think, some of the issues with health equity and health literacy is that, you know, people just, I'm not saying clinicians are not trustworthy, they are, but sometimes you have to ask questions and make sure they're not forgetting something or think you already know something, or, you know, think that, oh, well, that's just because of this, they rushed in here, you know. So having those conversations are very important. And I know sometimes it can be intimidating to have those conversations with a physician or a nurse. And, you know, and plus they're usually have limited time to spend. So it's important, though, to have those conversations. And that's what makes it so great for CHWs, because if they don't, the physician or the nurse doesn't really have a lot of time to work with the patient, then that community health worker can actually, you know, help them in getting some additional information, providing those resources to them.
And then going back to alcohol intake, someone had a question about, I guess, what is considered like a one standard drink? Would it be like a pint of beer?
Well, it would be like a can or a bottle of beer. I think a pint might be a little large. But there are, you know, like 8 ounces of beer, or, you know, a can. What is a can Coke? Like 12 ounces. I had a can of something in here and I was going to look, but I don't have it close by me. So, you know, maybe 8 to 16 ounces would be, depending on the alcohol, whatever it is. So a standard drink is based on the what type of alcohol it is, and then the ounces. So if it's a port or a sherry is actually like 5 ounces. If it's a, you know, a bottle or a can of beer, it could be, you know, 8 ounces, or it could be even up to 12. So you know, and in a glass of red wine would be 5 ounces. So depending on what it is, you know, that's going to determine the amount, but excuse me, of what a standard drink would be. But I think a pint or even a quart, or, you know, a 6-pack, that's going to be a lot more than a standard drink.
Kim, and just to finalize the Q&A, I think that we had a question about knowing programs that they could refer patients to, or offer free blood pressure kits for people who cannot afford them. I know you touched a little bit on that, but maybe on SMBP, and if you want to address that a little bit more or add something.
Yeah, definitely. And it depends on where someone lives. So one they can, if they have Medicaid, they can get a prescription and get that filled and get that monitor paid for free. The programs that we have are in Northeast Texas. So if you are in this area, you can contact us. You can email me or call me, or we do have a direct email to Lifestyle Change Programs at uthct.edu. And that's where we have hypertension, cholesterol management, pre-diabetes, and diabetes. We work with those programs. And also we have an active living after cancer program that's through MD Anderson. So those are all free programs. And again, if somebody's going to join our hypertension workshop and complete the program, they will get the monitor for free. And they can invite, you know, so maybe it's a husband and wife or a significant other, you know, or a mother and you know, a parent and their child, or not. I mean, they have to be 18 or above, but maybe it could be their daughter, their son, you know, and they are cousins or friends. But we do encourage, you know, accountability partners if they want to come, you know, because working together, someone is always going to have a better opportunity of success. Also, there's some other, excuse me, programs around the state, but I don't know all of them. I know the Department of State Health Services, you could contact them and they could share with you the locations of some of the partners they have. I know that there are some down in Jasper, Texas. I'm trying to think where else. Now that I'm being asked, I don't remember. But if you want to reach out to me, I can find out some information for you if you want, or you can just contact Department of State Health Services. It's the chronic, it's health promotion and chronic disease department. I don't remember their exact title, but it's definitely a promotion and prevention department. So those would be some good resources. And if you don't have something, you know, you're not currently have anything in your area, maybe that might be a new, you know, a new partnership they want to build. But that's how we started, excuse me, with ours, is working with Department of State Health Services. So it's really been awesome for our communities and our patients, because we serve both of them. It doesn't matter, you know, if you have insurance or if you don't, because we do not charge for these programs. Also, the next slide is going to provide some resources, you know, the different websites, health links and resources about blood pressure. And so here is the actual DSHS Heart and Stroke webpage. That'll be a good resource for you to go to.
Thank you so much, Kim, and I don't have any further questions.
All right, well, thank you. I really appreciate y'all allowing me to share with you today. And I do not have any further comments at this time. The next, I'll just say that, you know, these are some resources, and the next slide, excuse me, is our references that we've used. But of course, it'll all be on the slideshow, I mean, the slide presentations that we can send you.